Good afternoon and welcome to part 3 of No Smoke Without Fire, and I'm delighted to welcome Debbie Evans back into the pub again. Hello Debbie.
Good evening, Brian. It's delightful to be in a pub at long last.
I know, and as we pointed out last time, the pubs were all shut. If the pubs were open, people would be in them, they'd be talking, and they would certainly be talking about what's happening with COVID. And I'm sure that many people would be talking about the fact that they'd either had a vaccination or they knew somebody who'd had a vaccination, and they would be talking about those experiences, what their vaccination was like, what the experiences have been of other people. And we will say today we're going to have a look at adverse effects for vaccines. And there's a lot of information available which the government is simply not making available to the public. And we know that certainly GPs, for example, are not informing people of the benefits, if we believe in benefits of vaccinations, and the disadvantages. And the NHS policy is that people should be able to make an informed decision, so they should know the benefits and the disadvantages. But it seems that the authorities are not doing that. Now, Debbie, you've also been talking to people and you've been hearing some stories about how people have been getting on with vaccines. What can you tell us about that?
Well, what I can tell you, Brian, is that I'm not surprised, but I am surprised at how many people who announce that they have had the vaccine are telling me that they're not feeling too good afterwards, but maybe it's a coincidence, or they're itching, they're feeling out of sorts. A lot of people are saying they're feeling out of sorts and experiencing stuff that they haven't experienced before, like lightheadedness and headaches and feeling sick. And a number of people that I've spoken to, friends of mine, they've got friends who have actually been admitted to hospital and intensive care after having the vaccine. Now, of course, nobody's admitting that this has got anything to do with the vaccine, but it seems to be a lot of coincidences all at the same time, with many people telling me personally that actually they're not feeling too great.
And I've been hearing exactly the same thing. I've talked to people locally. Some have said they've had a vaccination and had no problems at all, but there were quite a number who said, well, I did actually feel poorly for a day. But also we've had an increasing amount of contact from people that are emailing in to the UK columns. Some of those people I've now been able to speak to, and they are talking about much more serious things. They're talking about colleagues who have had a protracted time off sick. They're talking about colleagues who have ended up with enormous skin problems and swollen lips and, sorry, a bit of background noise, I think. So some people seem to have done okay, but other people talking about colleagues who've had some pretty serious effects. They've had time off work, they're still feeling poorly. That's one sort of description, but we know of other people that have been through intensive care units, and people that have suffered real disability to the extent that they can't work. So today we thought we would deliver for our viewers and listeners, not just, well, not our opinion on what's happening. We thought we would deliver the government's own statistics. Now, the data that we're going to be talking about, this has all come from MHRA. So this is from the government's official body that should be checking that all is well with vaccinations. And the MHRA runs a yellow card system by which any incidents of adverse effects are reported. So you've had a look at this data. We're going to be showing it on screen in a minute for viewers. We'll obviously be talking about it for our listeners. But Debbie, you've gone through this data. It's comprehensive in some ways, in that there's a lot of entries into the respective databases, but in other ways there seems to be holes in how adverse effects are reported through to MHRA.
Yeah, absolutely. I mean, the government are conveniently giving a weekly data dump of these severe adverse side effects. However, what they're saying is, of course, we're not saying that these effects were attributable to the vaccine. We're merely saying that people were reporting these effects. And of course, the yellow card scheme is for members of the public, for clinicians, for anybody to be able to report side effects. And when you look at them, it would seem that every system of the body seems to be affected in some way. However, when we look at some of the conditions that people are reporting, what we're not seeing is the age of that person. We're not seeing any detail. We're not seeing a context. So, for example, we know that a lot of people are having falls after having both vaccines, but we don't know what the result of those falls were. Did that break did somebody sustain a fractured neck of femur, for example, through that fall? Did they sustain a head injury through that fall, which may have then precipitated a stroke? We don't know. So we're just getting figures every single week with specific conditions and no other data to confirm exactly what's gone on and to who.
Yeah, right. Okay, before we actually look at the data itself, just let's recap the sorts of things which the government or GPs teams or vaccination teams are saying to members of the public who are going to get a vaccine. They are being told that there are some possible side effects. What sort of things do the professionals tell a potential a person who's come to take a vaccine? What are the possibilities of the things they might experience?
Well, I could quote Professor Jonathan Van Tam, actually, because he said, and I'm not going to quote him directly because I haven't got it in front of me, but basically he said that the side effects for the vaccine should be considered as exactly the same on the back of a packet of paracetamol. So therefore, if you took out the instruction leaflet on paracetamol and you could see that the side effects could be gastric upset, nausea, vomiting, lightheadedness, all of those side effects, he said, you know, that's what you're looking at with the vaccines, pretty much the same side effects as you would get listed in a box of paracetamol, which to me was shocking. But that's what he said.
Well, that's interesting. I've heard this is just from a couple of people locally that they were told, well, you might get a little bit of irritation around the site of the vaccine. You might get a little bit of itchy skin. You could get a bit of redness. Mainly, they're being told, well, of course, you might feel a bit poorly for a day, 24 hours, possibly. What does poorly mean? It means that you might have some sort of flu symptoms. Maybe you feel a bit headachy or a bit hot. You certainly don't feel well, but they're saying don't worry about that. That's only a sort of very temporary thing, and that will pass, and away you go. So that is the background to what the state, what the NHS is telling people in the UK. For our viewers and listeners now, we're going to give them data which also comes from the state, but this is data which it would appear that the government and the MHRA would prefer the wider public not to know about. And I'm very confident that as we work through this material, some of our viewers and listeners are going to be totally shocked at what we're showing them. At the end of our chat today, we will point people at the very location they can go to check the data themselves, but the data we're putting on screen is the real thing. So let's do that now. And this is the header. So we've got data from up till the March the 16th. And what you have done here, Debbie, is to put this data side by side. So it's the real data from the government sources as posted on the MHRA site, but you've put it side by side so that we can make some instant comparisons. And on the left of the screen, we've got Pfizer mRNA, and that's versus the right-hand side of the screen, which is AstraZeneca GMO statistics. Do you want to add anything to that and how you selected material?
No, absolutely. The reason, actually, when we come to the slides, you'll see that the Pfizer data is actually on the left. That was a silly mistake of mine, but we'll come to that. But it's interesting to just make the definition between Pfizer, which is a messenger RNA virus, and AstraZeneca is a genetically modified organism. So they're technically two different products. Without going into the technical detail of it, I just needed people to know that they were different vaccines, different manufacturers, and all I'm doing is making a comparison against some statistics which may provoke people, hopefully, to go and look at the data themselves.
Yes, okay, right. So let's bring in this one. Now, you've been particularly interested with matters concerning with thrombosis. So we've got thrombocytopenia, if I pronounce that correctly. And just so that our viewers know, on screen, the left-hand column of data is Pfizer. And what it's saying is that there's been 24 cases, of which there's been one death. So it's 24 cases and one death. And on the right-hand side, we've got AstraZeneca, and then it's 43 cases and one death. But I'll talk a little bit more about this table in a moment. And Debbie, just take us through why you picked up on this particular table.
Well, as we know, there have been many issues just recently, and let's not forget, this is just weekly data. So this isn't cumulative from the start of vaccinations back in January or whenever it was. This is this week's data. And thrombocytopenia is actually mentioned on the government website as a caution pre-vaccination. So anybody that's got any blood clotting problems or are on blood thinners, anticoagulants, or suffer with thrombocytopenia should take the vaccine with caution. And that would indicate to me that probably not to take the vaccine and to speak to a medical practitioner first. So the fact that the government actually is warning people on the government website, and then we see clearly that we've got serious adverse effects affecting thrombocytopenia, which is a low platelet count. And for those of your viewers that aren't aware, that platelets are colourless cells and they help the blood clot. And platelets stop bleeding by clumping and forming plugs in the blood vessel injuries. Now, if somebody has got any type of coagulation problem with their blood, some are on medications such as warfarin. Other people that are immobile may be taking heparin and injecting that. Now, the issue with this is the blood has to be kept at a constant viscosity. So it can't be too thick where it clumps, and it can't be too thin where you bleed and you have internal bleeding perhaps. So a lot of people will go for an INR test to make sure that their blood's in good form before they take any other medication. So how many people, and that is my question, how many people with thrombocytopenia or that are on anticoagulation medication know their INR, or the person giving them the vaccine knows their INR before they're giving it? Because clearly we're seeing adverse reactions, and we would ask why when we've been warned that this could be an adverse reaction by both the manufacturer and the UK government.
Debbie, we're into a really different arena here already with one slide, because people are simply not being given any of this information. What would their reaction be if they had this information in front of them and they saw that the vaccines were impacting adversely on a particular medical condition which they had? We'll press this home as we go on through this session together, but I think this is one of the critical ones. I'll just bring that slide back on screen because I want to point out to people that whilst the particular line that Debbie has chosen, we've got 24 cases and 43 for Pfizer. There's other data on the particular list, and if I go for lymphatic system disorders, we're into, for Pfizer, 2,091 and 1,065 for AstraZeneca. So we're not talking in small numbers of people. We can now show on this table alone, we're jumping up into the thousands of people. And if I move through to the next one here, let's have a look at this. We're now into something which is obviously serious, because nobody would dismiss a heart attack as being anything but serious. And we've got Pfizer 34, of which 6 people died, and AstraZeneca 32, of which 13 people died. And again, we are talking about heart attacks, but we've got other descriptors to cardiac problems, palpitations, for example, which I know from people who've experienced this can be a deeply frightening experience, severe heart palpitations. For Pfizer, we've got 574. Can't quite see what that is on the AstraZeneca one, but we've got other effects for AstraZeneca as well. This is very serious stuff. This is not a bit of irritation around the site of the vaccine, Debbie.
No, this is a heart attack. And also what I want to sort of highlight is that these documents, we've just taken screenshots of a few of these conditions, but actually in each of these documents, it runs into 64 pages. So you've got 64 or 65 pages of Pfizer serious adverse reactions, and you've got 65 pages of AstraZeneca. So it's a huge document. So this is just a snapshot. And I mean, a heart attack, you know, what's happening to this data, Brian? How is there a post-mortem after someone's had a heart attack after having the vaccine? How do we know that this isn't directly attributable to the vaccine, or are these people just being buried or cremated and that's the end of the data, it just disappears? What's going on? Where's the investigation?
Well, at the moment, we're simply not finding any information about investigation of the adverse effects of the vaccines. We are told that they're collecting this data because it's important to collect it, but then you can't find a trail where there's an actual investigation going on. And if we stick on this subject, so we're into another section of this report, with cardiac arrest there, but at the bottom of the left-hand Pfizer table, it's saying that cardiac disorders in total, 1,226, of which there were 27 fatalities, and for AstraZeneca, 2,200, of which there were 38 fatalities. Now, we're not seeing these statistics anywhere. We're not seeing these statistics appearing on the BBC. We're not seeing any leaflets coming through our door warning about these sorts of effects on people. There can't be anything more serious than death, or the fact that you're going to have a heart attack or some sort of heart problem. I almost don't know what to...
We're not even getting a leaflet, Brian, giving us the ingredients, giving us the side effects, giving us the information at all. We're not getting any of the information, end of. And you know, this information that's coming out on the government website with the side effects, it's going nowhere. No one's talking about it anywhere. And yet this is a black triangle medication. And I know that we'll come on and talk towards the end about black triangle medications, but that means it's got to be under exceptional scrutiny from everybody. And yet no one's talking about it.
Okay, well, we will bring up a little bit later. We'll see if we can actually have the look at the data on the black triangle designation and also the green book that you've been talking about. But let's really hammer home this, the statistics here on problems that people not could have, but are having in relation to the vaccines. And this is deafness. So we've got 23 cases listed for Pfizer and 35 for AstraZeneca. That's in the table. And of course, the deafness is only part of what's actually listed. So we've got some medical terms here. I don't even know what they are, but we've got deafness neurosensory, 3. We've got deafness unilateral, and then we've got a hypoacusis.
Yeah.
Go ahead.
That's a fear and a complete dislike of loud, sudden noise. But the fact that, you know, deafness, these are very confusing terms for general members of the public when you get all these medical terms, but actually when you look at it more deeply, it becomes more worrying.
It becomes more worrying. So we go back into the Pfizer table and I look for the big numbers, and I'm looking at 233 people experiencing ear pain. We've got ear discomfort, 15, ear disorder, 3, ear swelling, 6. And if I go across and look at the AstraZeneca, 525 people experiencing ear pain. And the point that I've been making is that, of course, hearing loss, if you've had good hearing and the next day you don't have good hearing, that's a tremendously frightening situation for you. But how does that impact on your job? Do you have a job where you need your hearing? So these are just listed as if, well, you've got a bit of trouble hearing, but this actually could mean that you can't do your job or you can't do your job safely. And none of this is being recognised by the mainstream media at all.
No, it could mean that you can't communicate with the people that you could communicate with, that you can't hear people through a telephone or through a Zoom call like we are. I mean, these are life-changing, life-altering effects.
Yes. And, well, deafness is one thing. Let's bring in blindness. So we've got 16 for Pfizer and 30 for AstraZeneca. But again, of course, excuse me, it's not just blindness. For example, for the Pfizer, we've got 240 down for blurred vision. We've got 29 for photopsia, if I pronounce that correctly. We've got halo vision. We've got pupil disorders. We've got photophobia, 107. And if we go over to the AstraZeneca side, blurred vision, 333. Photopsia, 60. Diplopia, if I pronounce that one correctly, 45. And night blindness, sudden visual loss. There's a huge range of things covered. In fact, at the bottom of the AstraZeneca table on screen at the moment, it says visual impairment 101. So any of these things would be traumatic to a person who has had reasonably good sight, or they're used to having good sight. They have a vaccine and suddenly they can't see.
And I think, you know, Brian, it's not just that. If somebody has got a pre-existing eye condition, or maybe, you know, has had problems with their sight, this could potentially be exacerbating it to where they lose their sight. And, you know, for people that have got perfect vision now, is this going to impact their driving ability? Is it going to impact their job? Is it going to impact how they live at home? Are they going to be able to cook for themselves? You know, losing your sight is huge, absolutely huge. And why aren't we hearing about this?
Well, this is the amazing question, isn't it? And the sight aspect, yes, I can pay attention to this because let's be kind to the NHS. I can be kind to the NHS. I had a small operation done on one of my eyes, and I know that was very effective, virtually, well, I'm going to say 98% success, but very, very good indeed. But am I now in the position, or would I be a person in the position that if I go and have a vaccine, I'm particularly at risk of some extra problem with my eye. My own GP, I'm very happy to say to the audience today, who's been sending me letters that I should come and have a vaccine, of course, has given me no information about the vaccine dangers that we're going through now. And clearly nobody is looking at medical records and saying, doing things the other way around, saying, well, out of our patient list, we've got patients who we know we need to be particularly careful in calling them forward for a vaccine. So I am lost for words on this. It's outrageous, I think. Now, this one, diarrhea, we know that a very large number of people have suffered some form of tummy problem as a result of having the vaccine. So Pfizer here, 1,646 cases of diarrhea. But notice we've got the 4, that's 4 people that have died as a result of that condition. And for AstraZeneca, 2,827. And there's some other stomach type problems which are listed. There's abdominal distension here. We've got an ulcer is listed. This is not a minor issue, Debbie, is it?
No, it really isn't. And, you know, for me personally, I do have a gastrointestinal condition. So I was particularly interested to look at those statistics. And when I looked at them and I then thought of my own symptoms and my own condition, I thought there's no way. And I actually rang my doctor and I said, have you seen the adverse reactions? Because there's no way I'm going to risk taking a vaccine that could potentially make my condition an awful lot worse. So actually, on my own personal note, looking at that and diarrhea, and I can see why people die. You know, an elderly person that has an acute episode of diarrhea will very easily dehydrate. And, you know, we'll come on to the slides in the future about bleeding. And we've already talked about internal bleeding with thrombocytopenia. A lot of people don't even know they've got thrombocytopenia. So, you know, if it's an elderly person that's maybe got thin blood, you know, this could be potentially absolutely, well, I'm speechless, the same as you. You know, it's not nice at the best of times to have episodes of diarrhea. And the gastrointestinal severe side effects really do startle me a lot.
Right, well, let's add to that mix, because let's bring in abdominal pain here. So for Pfizer, we've got a total of 897, AstraZeneca, 2,768. So these are very large numbers and a whole spread of conditions. So we've got 20, for Pfizer, for example, we've got 28 people with gastroesophageal reflux disease. We've got constipation, we've got gastric disorder, we've got abdominal pain, 325, and that's subdivided. So there's also abdominal pain upper, 520, abdominal tenderness, 3. Across on the AstraZeneca side, abdominal pain, 1,328, abdominal pain upper, 1,384, 92 constipation, and 48 for the reflux disease. So again, we've got a whole spread here, Debbie, of problems, but who is investigating? If we play the game and remind the audience that the MRHA says when there's a report made under their yellow card system, that is being made because there's the possibility it could be connected to the vaccination, but that isn't certain. Well, of course, it only becomes certain if there's proper forensic investigation, which then says, well, yeah, there's no doubt that this is connected to the vaccine. But if we look at the scale of adverse effects that are coming up here and the spread of the sites, the spread of the types of things that are happening, I think only a fool could say there's not that there isn't an indication that the vaccines are actually causing these problems. I mean, is it me? Am I not looking at the right things because I'm not medically trained?
No, it's not you at all, Brian. And, you know, again, I reiterate, and I know we'll come on to it, but this is a medication that is under intense scrutiny. You know, it's got to be looked at very, very carefully. And it's not me that's saying that, it's the MHRA and Europe who have put it under a black triangle medication. So if we're being asked to report these serious adverse effects and we're not doing any clinical examinations afterwards or any post-mortems, it's fair to say that we cannot eliminate the fact that the vaccine has caused this condition. So they can't have it both ways. You know, they can't say on one hand, this is not attributable or it wouldn't appear to be attributable to the vaccine when there's no evidence to support that. So while there's no evidence, I think we should all look at this very cautiously and say, until we're told specifically that this is 100% nothing to do with the vaccine, then we should all be very, very cautious, not vaccine hesitant, but vaccine cautious.
This is a very good way of doing it, because if we go down the middle and say there are people out there who think that it's a good thing to go and get a vaccine, and we respect that opinion, we personally might not agree with it, but if we respect their opinion, then we can at least say to them, well, to ensure your own health and well-being and safety, at least understand what the possible side effects are and how that could affect you. You need that data. So we can be quite accommodating here by not taking too strident a stance in saying that any person in the country deserves this information, so they can make the informed choice which the NHS says. Now this one we're bringing, and the figures are now jumping dramatically. And what are we talking about? Well, essentially we're talking about nausea and being sick. And the figures here, huge increase. So Pfizer, we've got 5,953, but again, we've got 5 deaths. AstraZeneca, 16,028 with 2 deaths. And once again, there's a spread of problems. So we've got nausea and vomiting, but we're also seeing other stomach problems. Intestinal perforation is listed. We've got gastrointestinal hemorrhages listed, Pfizer 15 of those, but it's also there on the AstraZeneca side. We've got, just still there on AstraZeneca, we've got rectal hemorrhage, we've got anal hemorrhage, we've got small intestinal hemorrhage. These, to my mind, as a layperson, these are serious conditions. You do not want to be bleeding and not know what the cause is.
Well, they're very definitely very serious, because as we can see, 7 people have died, and, you know, 1 death is too many. But, you know, what I was thinking just as you were speaking there is this data, these are people that were happy or confident to take the vaccine. Now, why aren't we hearing from these people? Why aren't these people being allowed to talk about the side effects that they're experiencing, about their whole vaccine experience? Because these aren't anti-vaxxers or vaccine hesitant, as the government would have them be seen. These are people that have actually trusted what the government has said and gone ahead and had the vaccine, and they're not getting a voice. They're not being heard. We're having to look at this data, but these are all anonymous people who have got voices, and we're not hearing them. So why aren't we getting both sides of the debate, and we're interviewing some of these people or the clinicians that have made these reports to ask how they are now?
Well, Debbie, I can go a little bit more on that, because over the last few days, I have been contacted by people who've had the vaccine. They've had problems. For one person, this was quite severe skin problems, lumps, hives on their skin. So quite a serious reaction, to the extent they were advised by their GP they should not have a second jab. Other people have contacted us because they've suffered bleeding. And because of that bleeding, one person went on the internet to try and find out who was talking about vaccine adverse effects. And I've got to say, I was very surprised when that individual said to me, and the next thing I was watching the UK column news, and I decided to speak to you to see whether you knew where I could find more information. So whilst that's a compliment for us and what we're doing, it's pretty incredible if we've got people who are being injected, and when they go looking for help with the problems that they believe have arisen from the vaccine, they're not going to the NHS, they're coming through to the UK column. Let's have a look at fatigue here, as it's entitled. Sorry, I'm losing the mouse, which is causing a few problems. There we are. So Pfizer, 6,884. We've got a death. AstraZeneca, 16,349. Debbie, it's so strange, isn't it, that you see some of these things listed. They've got deaths with them, but they're not exactly talked about as if that death was serious. I don't know whether I've explained that very well, but this is the sort of confusion of these figures.
I mean, it's shocking. I mean, the government have been very quick to say right from the start of this whole COVID pandemic, in inverted commas, that one death is too many. And yet we're seeing many, many deaths cumulatively as a result of people reporting severe adverse reactions. And these are people that are taking the trouble to report it via the yellow card system, but they're just a statistic that's published once a week and then disappears. And I think, you know, people are being brave. They're being really brave. The people that have had the vaccines that are suffering side effects are being very brave in reporting that. And we need to be justifying that. And the NHS and the BBC and all the mainstream media need to be showing that these people are being listened to, because how many people are actually receiving help as a result of having an adverse reaction, or are they just being left at home in misery without any help at all?
Well, we've got to be accurate here, Debbie, and we say we simply don't know, because we're not seeing any clinical dialogue on how these people are being helped. I'm not seeing reports on the NHS websites. I'm not seeing reports in local papers, etc. So how do you know? Are they happening or not? We don't know. But can I bring that one back on screen again? You might tell me off if I get the subjects out of order, but you know, this jumps out to me. At the bottom of the Pfizer table on the left, we've got death and sudden death. What's included? Clinical death, death and sudden death. So we've got one clinical death.
I think we've got the fatigue slide up, Brian.
Pardon?
I think you've got the fatigue slide up.
That is correct, because yes, this slide you had highlighted fatigue, but what I was just pointing out for the audience is that actually lower down on this table it starts talking about death and sudden death. But if you've got that on a specific slide coming up, we'll deal with it then. But I've mentioned death, and that's a very serious subject. So here's Pfizer talking about one clinical death, 101 deaths, 15 sudden deaths. And for AstraZeneca, we've got one brain death, 141 deaths, and 12 sudden deaths. So what else can you say about this? We are not dealing with mild side effects. Ultimately, we're dealing with people losing their lives, and the information is here, but you have to delve into the site to get it. Let's move on through to the next one. Whether this answers the question, because you'd highlighted this slide with death, so I've preempted you. Sorry about that, Debbie. So
no worries.
Here's the statistics. And you were raising questions about the classifications of death, because we don't know the circumstances in which these people died.
No, we don't know whether they died immediately after having the vaccine, whether they died hours after, days after, weeks after. We've got no data, and death is death at the end of the day. Sudden death, was that at the vaccination centre, or was it suddenly while they were out walking? You know, it's not good enough data. It really isn't.
It isn't. Now, this one really makes me very interested, because you have quite rightly headlined it with influenza-like illness. And just before I put that up on the screen, I'm going to say, isn't this remarkable that the government has told us over the last few months that influenza, flu, has simply disappeared. It just walked away and was replaced by COVID. Flu has disappeared, according to the government, except when it starts to talk about side effects to vaccinations. So if we put this on the screen now, we've got influenza-like illness being described, 824 for the Pfizer, 3,343 for AstraZeneca. So remarkable, Debbie, that flu has disappeared, but listed on the government's own possible side effects for the vaccine are flu-like symptoms.
It seems that flu's flown back again. It flew away and now it's flown back again. It's extraordinary, isn't it? I can't, I've got words, Brian. I can't explain it.
No, well, I think we understand. Sorry, let's bring myself back on the screen. I think we understand what's happening is that people are playing with the language, and they're playing with our understanding in many areas. And of course, people are getting confused. People don't know what the truth is. They can be manipulated or the more easily. Now, this one is the serious stuff here, because this is anaphylactic shock. And do I know a little bit about this? Well, I'm going to say I do, because I've had a family member who many years ago dropped on the end of a needle when they were given a jab to test them out for hay fever. And the only reason they survived is that they had a very experienced hospital registrar with them when this event took place. But I've also seen other people that have experienced hives, lumps appearing on them, possibly as the result of an insect bite. But within a matter of seconds, a leg going from being normal to very red and swollen and angry. Anaphylactic shock, very dangerous thing, Debbie.
Incredibly. I mean, a rapid allergy reaction, for example. I mean, many people that have had anaphylactic or gone into anaphylactic shock or had an anaphylactic reaction, people with nut allergies, for example, egg allergies, some even carry EpiPens on them as an antidote if they should go into anaphylactic shock. So we're looking at something that could cause immediate death, itchiness, shortness of breath, vomiting, lightheadedness, low blood pressure, rash. And of course, we've seen previously slides with all of those conditions listed separately. So how do we know that that wasn't contributing to more anaphylactic shock? And also, if somebody is predisposed to anaphylactic shock or is allergic to something, then they should be aware that after they've had a vaccination, they should be very closely monitored for 30 minutes. And they should be monitored by a trained medical team that are experienced with very serious, rapid onset side effects, such as anaphylaxis. I mean, you know, it can happen in seconds. So you need an experienced cardiac arrest team on site with which to be able to deal with this. And I know we've spoken about this before on the phone, but you know, it seems that the St. John's ambulance are at some of these vaccination centres But as we know, the St. John's Ambulance protocol for cardiac arrest is that you should place a towel or a flannel over someone's face. Well, this is essentially suffocating someone that's in cardiac arrest. So I've got a lot of questions with regards to anaphylactic shock, specifically as the government do mention it on the website, that it should be treated with caution and that medical practitioners should consult and should counsel every patient prior to them having a vaccination. So this is indeed very, very serious.
I didn't give the totals there. Let's bring that slide back on screen. So for Pfizer, we've got a cumulative total of 239 for anaphylactic type incidents, and AstraZeneca 251. But if you go to the bottom of the little bit of table for AstraZeneca that I'm showing on screen, I know the text is very small. As I said just a little bit earlier in this program, this chat, we're going to point people where they can go to get the information for themselves. But I mean, if you freeze the screen and have a look at it, people will be able to see. So the total immune system disorders for AstraZeneca, 633. So again, we are seeing that this is not odd one or two people experiencing problems. This is hundreds of people. And we are being told by people working within the NHS that many of the vaccination centres have not had trained anaphylactic teams on site. We've also been told by many people who've actually had a vaccine that they were rushed through quite quickly. When they said, one person said, I said, shouldn't I sit down for a bit? Oh, no. Go and have a seat in your car for half an hour. So they were ushered out of the sight of the medical teams to go and sit in their car. If they'd have had some form of event in their car, there would have been nobody to help them. This is a shocking abuse of the public. Debbie?
Yeah, what if they drive? What if they suddenly got into their car and they drive and then they have a reaction when they're driving? That could potentially be lethal.
And well, there are some incidents now being reported where people, one that we saw earlier was I think it's in America, but there was an accident with some people turning out of a vaccine centre. I think there's also been an accident in Exeter, somewhere close to a vaccination centre. And I think it's reasonable to ask the question, could it be that the people coming out were suffering some form of effect? So they weren't actually, let's say they were distracted from driving with normal due care and attention. Something happened that distracted them. They felt suddenly a bit peaky or they felt sick. And the next minute they haven't paid attention with their driving. There's all sorts of possibilities here which nobody's investigating. So where does that take us? Well, this one is interesting in itself, coronavirus infections. So people having the vaccine, and then what do we say? It's discovered that they appear to have coronavirus. So Pfizer is 511, but there were 26 deaths associated with those people. And AstraZeneca 192 with 15 deaths. I find this one a bit interesting, Debbie, because what's going on here? You give people a vaccination, which is giving them the problem you're trying to protect them from. Or am I being am I being too simplistic?
No, you're not at all. And I don't think there's an easy explanation for it, because according to the government and according to the Chief Medical Officer, Chris Whitty, when you've had the injection, this does not give you coronavirus. So I guess their explanation would be, oh, well, you've caught it before and you were asymptomatic, but it makes no sense. It just makes no sense to me at all. And the fact that many people have died as well, I'm speechless, Brian. It makes to my own belts and braces nursing training, it makes no sense.
No sense. This one, I had to chat to you a little while ago, didn't we? We had a discussion about this because I didn't really know how to interpret it. But in the fights of data, you've got 41 events and a death, AstraZeneca 57 and a death. But the key one that you highlighted was people having falls. That was the 41 and the 57. But other things happening to people, an electric shock, a wound complication, an infusion-related reaction, an injection-related reaction. We've got nerve injuries. We've got post-lumbar puncture syndrome, procedural dizziness. We've got some incredible things here. I know that there's a lot of medical terminology which can sound pretty weird to the average lay person. So I'm very happy to say, well, Brian, the problem is you don't know enough medical terminology. But I'm also looking at this with common sense and saying, wait a minute, if these things have happened to people, what are we talking about? We're talking about them being vaccinated, and then the next minute they've fallen over and hit their head. Is that what they're talking about here?
Well, it's a very good question because, you know, when we look at who's been vaccinated currently, we're looking at the majority of people are elderly and vulnerable people. Now, hypothetically, they could have had the vaccine, felt dizzy, which is another serious side effect that's been reported, felt dizzy, or maybe had blurred vision, as we've already discussed, and tripped over and had a fall. So there could have been a whole line of serious adverse effects that have gone completely unnoticed. But what was the consequence of that fall? Could they have hit their head and then had a stroke? Could they have fallen over and fractured their neck of femur and been admitted to hospital? Again, we don't know the conditions or the context of this data, but it's extremely worrying that the majority of the elderly population have been vaccinated and there have been a lot of falls reported.
Yeah, and let's reinforce this, because let's bring on this one, which calls itself product administration errors. So for Pfizer, you've basically summarized it with 21 and AstraZeneca 10. What are we talking about? Well, we're talking about accidental overdoses, contraindicated product administered, inappropriate schedule of product administration, incomplete course of vaccination, product administered at an inappropriate site. I presume that's a site on the body as opposed to a geographic site. Product administered to patient of inappropriate age. Notice there is no age given. You don't know whether that was a child or an elderly person. Product administration error. This is saying quite clearly that we are seeing, I'm going to say, significant problems in the quality control, the medical quality control of how these vaccines are being given. And as a result, there's effects. So for Pfizer, it goes a little lower down the page and it's talking about face crushing, head injury, limb injuries, and we're going on to confusion. Everywhere we look, the adverse effects are broad spectrum, but if we're not even administering the vaccine properly, this is a recipe for absolute disaster.
Well, it's absolutely reprehensible and there's no excuse for it. And, you know, if a clinician was vaccinating someone that was trained, you probably wouldn't be having all of these incidents. But my question is who are the people that are vaccinating us? Because from where I'm sitting, they're not trained, they're volunteers, some of them, and they've only had a couple of hours training on site in a vaccination centre. They're not trained in giving an intramuscular injection, and this is what the vaccine is. It's an intramuscular injection. They're not trained in giving them properly. And, you know, are they being clinically supervised? And if so, by who? Is that supervised by a doctor, by a trained nurse, or perhaps a speech therapist or a chiropodist? I mean, I don't know.
I don't know. And let's reinforce our don't, our not knowing with this one, vaccine-related complications. You've headed it up, Pfizer 19, AstraZeneca 37. Airway burns, burn of an oral cavity, thermal burn, burn of the eye, vaccination complications. In fact, it says at the bottom of the Pfizer one, total injuries 500. AstraZeneca, back injury, head injury, limb crushing injury, skin abrasion, skin injury, burn of internal organs, thermal burn, thermal burns of eyes, vaccination complication 34, vaccination failure 3, that's your 37. But the total for this, as shown on screen, is 1,086. We're into thousands and thousands and thousands of people being damaged by this stuff, which the government says is good for us. Now, I've got, sorry, I've got too many screens in front of me. Reading this one, decreased platelet count. This is bringing us back to what you were warning about earlier on, isn't it?
Thrombocytopenia, when you have a low platelet count, it can indicate bleeding, hemorrhaging, things like simple things that you probably just dismiss, like a couple of nosebleeds, for example, could be quite relevant. So you need tip-top blood to be able to cope with any kind of medication, let alone a novel vaccine, which actually brings me on to, you know, the problems that we've seen with hematology and blood disorders. What happens when these vaccinated people donate blood to unvaccinated people? You know, that just opens up a whole new debate on when I think about the hepatitis blood contamination scandal. I'm now asking myself a question, well, if, God forbid, I needed a pint of blood, would I be receiving a pint of blood from somebody that's had the vaccine and has actually, it's affected their blood quality?
Yeah. I've got a little bit of an eye on the time, Debbie, at the moment. This is so important. I think we do need to run on for a bit. If I just flick through some of these and shout if you think that we need to discuss it a bit more, but let's see whether we can move through a bit. What are we trying to do here? We're trying to show to our audience that the data is real. The data about these dangerous adverse reactions is real, and it's involving thousands and thousands of people. It's there. It's just the government doesn't want to tell the general public about it. So this one here, COVID-19, you've called it, and we've got a series of reports on tests for SARS-CoV-2, antibody test positive, and that's both for the Pfizer 75 and AstraZeneca 50. Do we know what these vaccines are really doing to people? I'm going to suggest we don't. Let's have a look at this one here. Joint pain. Now we're into the thousands again. Pfizer 2,832, AstraZeneca 7,130. We've got joint pain, stiffness, swelling, warmth, and we've got a number of parts of the bodies affected. So this is obviously something quite serious. And if we go on through, myalgia, 4,085, 9,393. And I'm going to ask the question again, does this mean that these people or some of these people can't actually work anymore? Well, we don't know, and the government's not telling us. Central nervous system problems. Now, I will let you respond to this one because, of course, strokes are so dangerous and debilitating for people who've suffered them. Pfizer 91 with 9 deaths, and AstraZeneca 83 with 10 deaths. I know a number of elderly people who suffered from strokes, and it really is tragic to see how that's impacted on their lives. So you've been particularly worried about this clotting problem.
Yes, I have, and as we know that, you know, many European countries just recently have banned the use of AstraZeneca and have cautioned it. And even though the European Medicine Agency has come out and said, no, it's perfectly safe, we've still got a number of countries that are refusing to use AstraZeneca because I think it was Norway, and a Norwegian professor has actually confirmed that he believes that AstraZeneca was responsible for a number of brain clots. Now, what's interesting is a cerebrovascular accident is otherwise known as a stroke. I personally know 2 people who have had strokes in the past prior to the vaccination, and they've been particularly unwell since having the vaccination. And also interesting that I think it was 2 days ago, the government announced that there should now be special caution taken to anybody that's experiencing a headache for 4 days. So, you know, predisposing a stroke will obviously encounter things like raised blood pressure or headache or blurred vision. And I would say to anybody, if they've had the vaccine and they're receiving any of those side effects, blurred vision, or they've got their raised blood pressure, or they've got a severe headache, please report it to a doctor immediately, because this does predispose often a stroke. And as you can see there, Brian, the numbers are not good.
No, they're not good. And I'm going to work really hard to get through all the ones that you've prepared for us, because I know that you've done a huge amount of work to bring this material to us. Loss of consciousness, Pfizer 100, AstraZeneca 234. Are we talking about people becoming unconscious on that while the needle's in them or immediately afterwards? Is this where the falls come from?
Question.
I just do not know what to say about this, because the risks to people are just incredible. We've also got lethargy dropped in here, 1,518 people for AstraZeneca and 734. Well, if you're suffering lethargy, you're not going to be driving a train, are you? You're not.
I hope not.
Well, I say that, or a bus driver, anybody who's got a job where not only can they put themselves at risk, but put other members of the public at risk. What's happening here is immensely dangerous, particularly when the government and Matt Hancock and the rest of the SAGE team are not telling the people what the risks are. So what's the next one? Oh, well, thymus glands. Now, in part 2, you gave us a very good easy to understand little lecture on what the thymus gland was about, and you particularly highlighted the fact that the thymus gland was particularly important for pregnant women. What have we got going on here? We've got adverse effects to the thymus gland from the vaccine.
Yeah, the reason I highlighted this was because I didn't think, not a lot of people know that the thymus gland even exists, let alone that myasthenia gravis is a disorder that's directly associated to the thymus gland. It slows it down. Now, the thymus gland, as we've spoken about before, is very important in pregnancy because it actually prevents miscarriage. So I think we'll come on to slides with regards to pregnancy in a minute, but yeah, okay. Very worrying.
Well, here's paralysis, 22 for Pfizer and 63 for AstraZeneca, so serious stuff as well. Well, here it is, spontaneous abortion, Pfizer 23, AstraZeneca 5. Why isn't this headline news for the BBC? Why isn't this over the headlines of all of our newspapers, The Guardian and the Daily Mail? Are these journalists totally ignorant of this? It's possible. We'll help educate them. Or is it that they are now deliberately covering up these serious issues in order to adhere to a government policy, and to hell with the consequences?
I'm fearing that it could be that they're not reporting it because they're being told not to by somebody, or they're being told not to highlight it.
Right, and because so, Debbie, if you're right, sorry to interrupt you there, if you're correct, and I think you've made a very reasonable assumption, then the people telling the press not to report damage and injury from the vaccines they're culpable. Those people are directly culpable. They are responsible for injury to members of the public. If they assaulted them by punching them or they stabbed them with a knife, they would have to appear in court. And if they were guilty, hopefully they'd be locked up for a long time. We've got people here assaulting people through the vaccination problem, and they're hiding it.
Yeah, the information is being withheld, I believe, deliberately.
Deliberately. Confusion. Well, that's going to be something which is disastrous for any elderly people that have perhaps got early onset of dementia or a little bit of forgetfulness. Pfizer 201, AstraZeneca 761, and it's talking about confusional state 546, disorientation 215. So absolutely disastrous for people who are already very, very vulnerable. And of course, what's the government policy to get into the care homes and the residential homes for elderly people and inject them full of this stuff? It's so callous and cynical. And well, for the men out there, you need to pay attention. Erectile dysfunction, you've got 8 for Pfizer here and 8 for AstraZeneca. This is part of a catalogue of things which seem to be attacking reproductive systems, isn't it, Debbie?
Yeah, it definitely is. And, you know, it's not just the men, it's the women as well. And it seems to be with Pfizer, particularly, we're looking at higher numbers. I know there we're seeing 8 and 8 with AstraZeneca, but if you look at spontaneous abortions and if you look at other conditions with regards to the reproductive system and sterilization, etc., it seems that Pfizer is slightly ahead.
Yes, well, if we just pop this back on screen, because at the bottom of the Pfizer table, you've got menstruation and uterine bleeding, and we've got menstrual disorder 26, dysmenorrhea 23, menstruation irregular 21. What's it for AstraZeneca? Well, menstrual disorder 15, menstruation irregular 14. So these are all serious effects for men and women, which would appear to be indicating that there could be serious risks to reproduction for people. I didn't mean to do that. Let's carry on through. What have we got next? Vaginal hemorrhage. And again, we're into this danger of bleeding, which you talked about.
Yeah, and I think this is, again, you know, we're not getting the sufficient data because we know that a lot of the elderly people have been vaccinated. So are we talking elderly people are experiencing vaginal hemorrhages, or is this happening in younger, more vulnerable people? We don't know the data, so we can't possibly see the context of it, but it's extremely worrying when we know that bleeding has been a side effect that has been talked about by different countries with regards to both vaccines, the Pfizer and the AstraZeneca.
Yes, and so that slide should have popped up on the screen again now, and we were talking 40 vaginal hemorrhages for the Pfizer and 51 for AstraZeneca, but a whole range of problems there, which of course for the average person are going to be deeply worrying, and they should be. Well, it's worrying for the individual, but it should be worrying for the population because we don't know what's being done to people here. So there's testicular problems here, pain and swelling. So is this an attack on people's reproductive systems? What's the next one up? Breathlessness, and again, we're into the thousands of people. Well, 969 for Pfizer with 2 deaths. 1,470 with 2 deaths for AstraZeneca. But many people these days have got breathing problems, haven't they? The number of people that have to use some form of inhaler because they've got asthma or they've got some other respiratory problem. And yet here's a side effect of the vaccine causing that problem. So do you want to say anything more about that from a medical point of view?
Again, you know, we're looking at dyspnea, breathlessness, and of course that could be a symptom of something else, like an anaphylactic shock. It could be a symptom of a stroke. It could be the symptom of a severe asthma attack on the way. So again, these statistics is very, very worrying. And if people are having to go into these vaccination centres with masks on, you know, they're already struggling to breathe, and now we've got side effects of them having even more problems breathing.
Yeah. And okay, where can we go now? We've got about 4 of these slides still to do. Bring this on screen because we're back on the thrombocytopenia subject. Pfizer 171, AstraZeneca 224. Do you want to say anything else on that, or have we covered that one, do you think?
I think we've pretty much covered it. It's just so that people are aware that, you know, thrombocytopenia doesn't need to be have serious symptoms. You could have thrombocytopenia and not even know it. So something as simple as a few nosebleeds, my advice would be to seek medical attention and get a blood test done and check your platelet count.
Yeah, and we've got to reinforce this because we are reporting the government's, bring myself back on screen, we're reporting the government's own data, and we are drawing, from my point of view, a layperson's common sense conclusion from the data that we're seeing, and that's telling me we should be deeply concerned about what's happening. You are commenting from the point of view that you are medically trained, so your level of competence is above mine. But we've got to be saying to the wider public, when you look at this data, if you have concerns, then it seems that the most sensible thing is you should be going straight back to your GP or the NHS to ask whether you need, you know, to take particular precautions of vaccine because of these side effects. So 3 more to go. What have we got here? Well, this seems relatively unimportant rash, but a lot of people, Pfizer 1,467, AstraZeneca 1,662. But of course, rashes for people, particularly if they appear on their face or neck, or even their hands, visible parts of the flesh, can be incredibly embarrassing and put them under huge stress. But would I be right in saying that a rash is likely to be tied in with some form of anaphylactic reaction? Or would this be something?
It could be, yes. And it could also be indicative, depending on where the rash is. And I have looked at the stats, and I can see that a lot of rashes are occurring around injection sites. So we need to then look at the effects of the rash. Could it be caused because of cellulitis, for example? And cellulitis can be life-threatening and needs immediate medical attention. It's a bacterial infection, and it causes a rash. The rash gets bigger and bigger. And it spreads into the whole body, so you need antibiotic therapy quite quickly. So what seems innocuous on a piece of on a slide like a rash could actually be quite significant.
Okay, so 2 more, of which the final slide is the most serious of the lot, most significant of the lot. This one here, tell us about this, because I have to bow to your superior knowledge.
Well, I don't know about the most serious, because I mean, I don't think you can get any more serious than death or cardiac arrest, but an awful lot of people that I'm speaking to and that are contacting me personally, and some of them are almost apologizing to me. It's terribly sad, because they're saying, I wish I'd have listened to you. I wish I hadn't have had the injection, but I've literally scratched all my skin off my body, and it's, you know, they're covered in wet towels and having to have cold showers so many times, because urticaria is literally, I can't even begin. I've seen somebody with urticaria, and it's almost like they cannot stop scratching, and they're scratching their skin off their bodies. So this is potentially really serious, and it can lead to loads of other problems as well. And the fact that these are being reported by both manufacturers at about the same rate, it's extremely uncomfortable, and I'm just staggered really that nobody's taking more notice.
Debbie, thank you for that. So we've got that slide back on screen. The totals there for people were Pfizer 509 and AstraZeneca 524. But at the bottom of those tables are the totals for problems with skin disorders. For Pfizer, that's 7,308 people. And actually, there's a fatality listed there as well. For skin disorders, total for AstraZeneca, that's 12,083. So big numbers. There was one more slide, which is the one I meant was the significant one, which we'll go to now, because this is the one talking about fatal outcomes. And there are some questions to be asked about the way these statistics are reported. But for Pfizer, the fatal outcomes are listed as 237, AstraZeneca 289. And we've got total reactions for the drug, 100,809 with 237 fatalities. Total reports 35,325, and total fatal outcome reports 237. And if we go to the AstraZeneca side, we're into total reactions for the drug, 228,337, of which 289 were fatal, and the total reports 61,304. Not a squeak in the press or the media about this, Debbie. This is the bit which is just so incredible. Blanket silence. By saying what I'm about to say, sorry, I'm not being unkind in any way, but the BBC will often tell us when a bus crashes in a foreign country because out of the bus 20 people, 30 people die. That is a major news scoop for the BBC, reporting from a third world country. And is that tragic? Is it tragic for those people to die? Of course it is. But here we are with hundreds of people dying, it would seem, as a result of adverse reactions to the virus, not a peep out of the BBC.
Adverse reactions to the vaccine, I think you meant to say.
Sorry,
then.
Did I say adverse reactions to the BBC?
Reactions to the virus, no, to the virus.
Well,
no, I mean,
well, maybe we're a bit too close to the truth with that they're getting the virus.
Yeah, absolutely. And you know, if you look at the reports, and if people do dig down a bit and don't take any notice of the BBC and Sky and ITV and all the rest of the mainstream media, you can quite clearly see that Israel, for example, are having huge problems with side effects of the Pfizer vaccine. Many people with facial paralysis, many people dying. So, you know, I would say to everybody listening, you know, dig down a bit and have a look and get the information before you make the decision. And if it means that you have to put off having the vaccine, then put it off until you're confident that it's okay to have. Vaccine hesitancy is not the same as vaccine caution.
Yeah, and we're advocating caution with a very big C. Now, we'll say another 5 minutes to close. I'll just bring up on the screen, this is part of, if I've got this right, this is part of the green book that you've just mentioned casually. So this is part of the instructions that the medical teams are getting about COVID-19 and what's to be done about it. And if I understand correctly, your criticism is that when you read through this official material, it's all very casual about what's happening, whereas we've just shown data which would suggest that we need to be a lot more careful and diligent and questioning about what's going on.
Yeah, basically the Green Book throws caution to the wind and tells medical practitioners basically that anything goes, and basically everyone will be fine if they've had the vaccine. There may be a few things to look out for, but basically that's your manual for clinical practitioners, who's in the high risk groups, etc., etc. A very interesting book, but it seems to be completely in contradiction to what the government website says.
Yeah, and we do this one as well. But this is gov.uk talking about the Black Triangle medicines as part of an EU-wide scheme. And this Black Triangle is very significant by what it designates. Is that right?
Yes, it is. If it's part of the Black Triangle scheme, it means that it's got to be under intense scrutiny by the MHRA. Now, we've had it in the UK, the Black Triangle scheme, for many years, but Europe have taken it on now as well. And AstraZeneca and Pfizer, in fact, I rang my pharmacist who wasn't aware. He's a lovely, lovely chap, but he wasn't actually aware of the Black Triangle scheme, which I was slightly concerned about. But it means that the AstraZeneca and Pfizer are under intense scrutiny. And by that, they're promoting reporting of the yellow card system. So, you know, if it's under intense scrutiny by everybody and people are reporting adverse effects, and goodness knows how many people aren't because they're not aware of that the yellow card system exists. But if this is so, then why aren't we hearing about these thousands, literally thousands of side effects?
Yeah. Okay, and let's have a look. Let's just see what else we can bring up on screen, which is pertinent. This one here, a report saying frightening, the 7th update on adverse reactions to COVID vaccines released by the UK government. So I'm not very familiar with the daily expose, but other people in new media, let's be positive, let's not call it alternative, in new media are showing warnings, are beginning to focus in the right place. So we've got that one. And just to make this point, this is the report of the bus crash near Exeter's mass vaccination centre, latest update. Now, I don't know what happened in this accident, but we were really making a very serious point where we say if people are coming out of vaccine centres and they're feeling fatigued or confused, which is what is being reported in the side effects, could this have actually affected the accident itself? Well, I don't know what the answer is, but I think we can raise the question. And we may have one more. Well, I think we'll bring this one up. This is actually from the States, Wyoming, okay, a little bit of text on screen, so I'll read it. But it says 2 killed in crash outside vaccination clinic. And this is 2 elderly women who were killed in a 2-vehicle crash on Tuesday night in Gainesville, Wyoming County. So they were 2 elderly ladies who both died, and they pulled out of that vaccine clinic. So the point that Debbie and I have been making, and I think it's a justifiable point, is are we now in a position where we're going to see accidents happen as a result of adverse effects from vaccines? Debbie, we've covered a huge amount of ground. I think we should leave it there. I will make sure that at the end of the video, I put the links through to the MHRA adverse reaction tables, which you've kindly summarised and analysed for us. And I'll just remind our audience that those tables are being updated. So when you go and see the data, it may already have been changed and be different from the data that Debbie's captured. But nevertheless, we have captured this data and embedded it into this video. So MHRA is not going to be able to change the data we've shown you today. Debbie, some closing words.
I think my biggest point is please look at the data and please pass on the message to other people. If you know that they've had the vaccination and they are suffering serious side effects or any side effects, because it is a Black Triangle medicine, point them in the right direction for the yellow card scheme, because unless people know that the yellow card scheme exists, people won't use it. So please just look at the data and consider your own medical conditions prior to you making a decision, because it could be that one of your conditions is listed within the adverse reaction data that it might just make you think twice.
Okay, thank you very much for that. And I would say that if you've stayed with us during this discussion, you've seen that information for yourself. If you're at all concerned, and we believe you should be, please will you share this so that we can start to alert other people and to at least get them to look at the government's own data set in order to make their mind up. So we rely very much on our audience in order to share that data. And if you can do that, we will all be helping people who may be about to have a vaccine when they shouldn't, or people possibly who are looking for answers because they've already had a vaccination. Debbie, I'm going to say thank you very much for joining me. I am sorry I can't say to you now, come and have a glass of wine. Come and join me at the bar and have a glass of wine. Because let's face it, if we were really in a pub now, I think the people around us would have been earwigging as we reeled off all those statistics. And you can imagine that we would have seen people possibly coming up to us and saying, that wasn't right, was it, what you were talking about? And what would we have said? Well, don't believe us, look at the government's own data. Why are the pubs shut? To stop people sharing the reality of what's happening. So I'm really sorry, I can't take you to the bar, I can't get you a drink, but perhaps we'll be able to do that in the future. So that's it for this evening. Thank you very much to all our viewers that have joined us. And for those of you who are curious, it is Robbie Burns in the picture that you can see above the fireplace. And this was a very lovely pub, which David Scott took me to several years ago. And I never expected the little photograph I took to prove to be so nice and so helpful. We'll leave it there. Debbie, thanks very much for joining me. Bye-bye.
Thank you, Brian. Bye.
Yeah, bye.